Assalamu alaikum and hello. This is Bakr Saleh and this is my presentation for assignment 1 for the topic that I have chosen, which is bone cancer. So, bone cancer, we start here to explain bone cancer in general. So, the primary bone cancers include osteosarcoma, Ewing sarcoma. There are three types: osteosarcoma, Ewing sarcoma, and chondrosarcoma. They most commonly occur in the long bones, legs, more than the arms, and those cancers account to only less than 1% of the diagnosis annually and are responsible for high morbidity in cancer patients. It is actually, in fact, uh, the non-cancerous tumors have more diagnosis rate than the cancerous tumors. So, but the true occurrence is difficult to detect and diagnose because of their rarity and because of late patient presentation of symptoms uh, and non-specific for non-specific symptoms that mimic common musculoskeletal injuries and low suspicion by the physicians. Plain radiography is the preferred diagnostic test. So, diagnosis. So, in diagnosis, because of its low incidence and ambiguous initial symptoms, bone cancer can be difficult to diagnose when doctors think of bone cancer as a differential diagnosis and quickly obtain imaging. They make a timely diagnosis. So, plain radiography is preferred imaging modality for diagnosing malignant bone tumors. So it is highly the PET CT scan. It is high accurate to detect the cancerous in the cancer in bone, and so we start with the PET scan. It is used to combine the two modalities and the anatomy and the two modalities of the PET scan, PET scan, and CT scan. So it takes from the CT scan the anatomical specifications and the metabolic scan from the PET yeah, using tracers. It generates an image that allows the doctors to early detect and diagnose malignant and cancerous bone tumors in the human body. So it has low risk for the bone cancer patient from radiation and tracers. So, and high evaluation success rate for diagnosis. So during the detection of cancer, they are using the tracer 18F FDG, which is a custom form of glucose tracer. It is used in PET scan for cancer detection, which gets absorbed by tissues. And then when the tissues absorb a lot of glucose, it may indicate the occurrence of cancer. So it has a half-life of 4 hours. The radiation risk is low comparing to the annual radiation that every individual in the world is exposed to. CT scan creates an image of the anatomical image of the body. So in combination, we have a composite image from the two, a 3D composite image from the two. The 3D is created by PET scan, and the anatomical image is created by CT scan. So the composite image helps the doctor detect early bone cancer. So here we have an image from the first section of the image on the left. We have a CT scan, and the second, the mid image, the mid section of the image, we have a PET scan, and the third one on the right, we have a composite image of the two. So in this image, the patient has osteosarcoma on the lower part of the right femur, the thigh bone, with osteolysis, which is bone loss, and osteoblastic infiltration, deposition of new bone in the soft tissue. So we have the disadvantages of the PET scan, the chosen PET scan. The radiation affects pregnancies and it increases the radiation risk generated by the PET elements procedure, that it increases the occurrence of another cancer other than the bone cancer during the patient exposure to radiation. And the third disadvantage is the diabetes patients. When diabetes patients have insulin intakes and dosages, the results may be interrupted because the tracer uses a form of glucose in the blood. Thank you very much.